Assalamualaikum and hi everyone. My name is Nur Zuliana. Today I would like to share with you about leukemia. Before we go to our topic, I would like to introduce to you my member group. Before we go to our topic, we will know the objective for this topic of leukemia, etiology, pathophysiology, classification, type, risk factor, symptom, diagnosis, treatment, prognosis, and nursing management. So I would like to show you the definition, etiology, pathophysiology, classification, and type. So what is leukemia? Leukemia is a cancer which state in blood-forming tissue, usually the bone marrow. It leads to the user production of abnormal white blood cell, the part of the immune system which defend the body against infection. Classification and type, we must know the pathophysiology of leukemia. First, malignant disorder of the hematopoietic system. Excess leukocyte accumulate in the bone marrow and lymphoid. Bone marrow produce immature cell, which means they produce lot of myeloid and leukocyte and don't have enough space to make the bone marrow produce the mature cell. Third cause unknown. Possible cause include genetic, virus, exposed to radiation, and chemotherapy. The classification of leukemia. Leukemia was classified depending upon the type of white blood cell that makes up the leukemia cells. It can be myeloid or lymphoid. Acute leukemia is called when the type of abnormal cell produced and developed rapidly. Chronic leukemia develops slowly over time. This leukemia may not cause specific symptoms at the beginning of their course. Type of leukemia. We have 4 types of leukemia. First, acute lymphocytic leukemia, ALL, is the most common type of leukemia in children, but it can also affect adults. Chronic lymphocytic leukemia, CLL, a slow-growing cancer of lymphoid cells that usually affect people over 55 years of age. Then acute myeloid leukemia, AML, involves the rapid growth of myeloid cells. It's occurs in both adults and children. And chronic myeloid leukemia, CML, a type of chronic myeloproliferative disorder that primarily affects adults. So for the risk factor for the leukemia, I would like to invite my friend Norliana to present it.
Risk factor of leukemia. First, age. Most common of leukemia are common in older people. The main exception to this is ALL, in which peak incidence in children. The second one is gender. Leukemia are generally more common in males. Number 3 is genetics. Although leukemia is not an inherited disease, there is a slightly higher chance that close relatively of patient may develop some form developing leukemia, Down syndrome child. Number 4 is chemical exposure. Being exposed to some chemicals on high levels of radiation may increase the chance of developing leukemia. Number 5, some forms of leukemia are seen more commonly in people who have another bone marrow disorder. The most common disorder which behave in this way are myelodysplastic syndrome, MDS, and the myeloproliferative neoplasm, MPN. Sign and symptom. It should be too systemic. Weight may be lost, lymph nodes will swelling, spleen become enlargement, skin. You will see this Your skin will not sweat, easy bleeding and bruising, or purplish, patch, and or spots. The physiological fatigue and loss of appetite, lungs will be short of breath, muscular will be weakness, bones or joints will be pain or tenderness, and liver will be enlargement. This is we call it ANT. A for anemia will decrease your HB hemoglobin, and for neutropenia it is a risk of infection. T for thrombocytopenia, it will cause bleeding. Did you think leukemia is a numerous immature white blood cells like ants in an ant colony?
Assalamualaikum, my name is Wan Ahmad Fatifahan. I will proceed with diagnostic test. First, we must take history of family background, social life, sign and symptom. The next one is we must take blood test for investigation, which are result with low RBC platelets and low white blood cell. And then we go to bone marrow aspiration. The doctor removes some bone marrow from the hip bone or another large bone. A pathologist examines the sample under a microscope. Next, bone marrow biopsy. The prognosis of leukemia depends upon the type of leukemia that is present and the age and health status of the patient. Mortality rates for leukemia are higher in the elderly than in younger adults or children.
Next is nursing diagnosis. As we know, people with leukemia, they are more deficit knowledge. Patient come with insufficient information or insufficient interest in learning or so on, evidenced by insufficient knowledge, inaccurate follow-through instruction, or inappropriate behavior. So our goal is to improve patient knowledge about leukemia. So the outcome will be patient understand about the diagnosis of leukemia. So this is our intervention. Firstly, we assess the patient. Secondly, assess patient education background. Ask for patient cooperation and permission. Next is we create suitable method of communicating with patient. Fifth, encourage family members' involvement. Sixth, use of appropriate and accurate information to patient, and we assess patient. The next one is risk of bleeding. Related to bone marrow depression, secondary to chemotherapy, or maybe proliferation of leukemic cells, evidenced by platelet count within acceptable limits, compliance with preventive measure. Our goal is to reduce the risk of bleeding. So the outcome will be patient risk of bleeding reduced. So our intervention is assess size and symptom of bleeding, not bleeding for any recent procedure site, explain to the patient the symptom of thrombocytopenia, instruct patient in precautionary measures such as use of toothbrush. Next, advise patient to avoid straining with bowel movements. Advise patient to avoid sharp objects. Avoid intramuscular and subcutaneous injection. The next one, apply pressure or dressing or put sand back to the bone marrow aspiration site. And the next one, inform the patient the purpose and possible reaction to blood transfusion. The next one is risk for infection related to inadequate secondary defenses, inadequate primary defenses, and also invasive procedure, evidenced by alteration in mature white blood cells, increased number of immature lymphocyte, and body temperature more than 38 degrees Celsius. Our goal is to prevent or reduce risk of infection. So the outcome will be patient risk of infection reduced. Our intervention is assess patient condition first. Require good hand hygiene, visit visitor as indicated, closely monitor temperature, change IV tubing according to date, and use strict sterile technique. The next one, promote good self-hygiene. And lastly, encourage intake of high protein diet and fluid with adequate fiber. The next nursing diagnosis is risk for deficit fluid volume related to excessive losses, decreased fluid intake, increased fluid need, and malnutrition, evidenced by vomiting, diarrhea, nausea, and also hypometabolic state or fever. Our goal is to prevent development of dehydration. So the outcome will be patient obtaining adequate fluid volume. So our intervention will be assess patient condition, monitor intake and output patient, promote good nutrition, monitor blood pressure and heart rate, encourage fluid intake, evaluate skin growth, and also note presence of nausea and fever. The next one is acute pain related to physical agents such as enlarged organs or lymph nodes, chemical agents, physiological manifestation such as anxiety or fear, evidenced by report of pain, guarding or distraction behaviors, or autonomic response. Our goal will be relief or control pain. The outcome will be report pain and relief or control. Our intervention will be assess patient condition by using pain score 1 to 10, monitor vital signs, provide comfortable environment and reduce stressful stimuli, place in position of comfort and support joints, reposition periodically, and assist with gentle RM exercises, provide comfort measure and psychological support, evaluate and support patient coping mechanism, assist with provide these divisional activities, and also administer medication as indicated. The next one is cancer-related fatigue related to tumor, chemotherapy, radiation, pain, distress, anxiety, malnutrition or anemia, evidenced by a sense of physical or emotional tiredness, inability to restore energy, verbalization of overwhelming lack of energy. Our goal will be increased energy and ability to perform desired activity. The outcome will be patient reports reduction in fatigue. Our intervention will be assess for fatigue regularly, educate the patient regarding tiredness and treatment, teach patient to how assigning priorities to activities, teach patient about conserving strategies, advise patient of limit naps to 20 to 30 minutes, consult regarding nutrition intake, and also give cognitive behavior therapy. This is our reference. So that's all from us. Thank you.